Singh, Additional Chief Secretary, Department of Health and Family Welfare, Government of Jharkhand. Sir, if you could please join us on stage.
Good afternoon, ladies and gentlemen. This is the session after lunch, and a lot of our colleagues are still enjoying the sumptuous lunch offered by Ravi ji and his team. And those who are fortunate or unfortunate have joined us for this after lunch session. I hope you'll all stay awake. My dear friend Dr. Hira Lal ji, who is a very distinguished IAS officer of Uttar Pradesh with huge credentials of public service and adopting the grassroots approach and very innovative solutions which are realistic and result oriented. Dr. Sailesh Jain ji, who is heart transplant surgeon and CMD of Universal Hospital. Dr. Pankaj Gupta ji, head of Taurus Global Consulting, and my dear friend Ravi Gupta ji, and dear friends amongst the audience. This is the presentation which I am going to make regarding the digital technologies in the healthcare. And deliberations have been going on since yesterday. And our dear Dr. R.S. Sharma, who was our ex-Chief Secretary of Jharkhand, and was a lot of love and affection for me. And I've been interacting with him since last 33 years. When I was a probationer, he was our Deputy Commissioners of Dhanbad. So he's heading the National Health Authority and he's the CEO. And a lot of initiatives have been taken by him. And in fact, when he was in the state also, he took a lot of initiatives to bring in the digital component in governance. So, how technology can transform the healthcare? We can transform the unsustainable healthcare system into a sustainable one, equalize the relationship between the medical professionals and the patients, provide cheaper, faster, and more effective solutions for diseases, and digital health have profound impact on how health services are delivered and how health systems are run. You must have had an interaction regarding the Ayushman Bharat Digital Mission. This is just a bird's eye view of what is being undertaken under that program to create the health ID, which is now called ABHA, Ayushman Bharat Health Account, to have healthcare professional registry, healthcare facility registry, health records, and electronic medical records. So this is a whole gamut of information, and this information is collated to bring out the best of results. Now, technology which can be used in health, because in the present time the magnitude of the health issues and as the population is increasing, so the data is so much that it is difficult to analyze this data and come to certain conclusion how to use this information to resolve the health issues. So this technology can be used to allow people to manage their health more effectively. We can use to identify the risks and reducing the harm in the primary care setting. We have better ways of diagnosing the diseases. The quality of care can be monitored in a better manner. We can monitor the impact of policies on population health since we have the data available. Then point of care diagnosis, tracking supplies of drugs and vaccines for health management system, how we can optimally utilize the health system, optimally utilize the utilization of the drugs, inventory management, and mapping and monitoring the spread of infectious disease. So it's a hell lot of spectrum in which the technology can be used in providing better health services. Instant access to information of beneficiary, cost-effective health management system, regular and right reporting by field functionaries, individual monitoring of progress of beneficiaries, analysis of data for prompt and early interventions and future planning and research. Technology can be used to improve the primary health care, facilitating the clinical support, monitoring quality of care, tracking supplies of drug and vaccines as I mentioned earlier, building robust referral system, plan advanced hospitalization, avoid unplanned hospitalization, unnecessary hospitalization of person who don't need hospitalization and they in the due course spend so much of money. Redirecting the intervention from secondary and tertiary care facilities, point of care diagnostic testing, facilitating their education and training through digital tools such as e-learning, disease monitoring and surveillance, and targeted health campaigns. So these are basically various technologies to be utilized for providing the primary health care. And in Jharkhand, we have ASHA workers at the village level. So we have around 33,000 villages and we have 40,000 ASHA workers. One ASHA worker which we call them Sahiyas. So we are empowering these Sahiyas to take care of the health of the whole village. Every village would be having around 200 houses, 250 houses. And Asha, since she stays in that village, so she knows each and every household. कहाँ शादी हो रही है, कहाँ बच्चा हुआ है, where, which house has old people, which house has diseased people, which house has young girls. So she has all sort of information as far as that village is concerned. So we have come up with a new model of empowering our Ashas through e-tool. That is Swasth. We have come up with a Swasth Prahari Yojana. She is a Prahari of Swasth at the village level. Health guard, you can say. She is going to be provided a tab. She would be trained also. They are already using these smartphones, so it is not out of context for them. And we are developing a Sahiya app. And that app would be utilized for the management information system of the operations conducted by a Sahiya, how she handles various issues and provide information to the higher level, providing tele-consultancy services through her tab. She is also going to be provided a medicinal kit so that she can provide basic primary medicines to the person who need. And if required, we have 108 ambulance service which can be recalled. We are also coming up with a Mamta Vahan service for providing the referral transport service to the maternal issues. to the pregnant women. So these tabs would be utilized, and then IEC promoting the various initiatives taken in the health sector and what would be of benefit to the people, to the particular sector of the people, particular section of the people. So these tabs are going to be provided to the sahyas, 40,000 sahyas, and that we are going to provide them on rental basis. For that we will be coming up with a tender, e-tender. So that will be a big opportunity to improve the primary health care. We are also going in a big way to take up the school health, ensure each and every kid who is going to the school, his health is being scanned for various diseases, ENT, eyes, and would be provided the training of yoga every week. Every school in the state is going to have yoga sessions so that the health and wellness campaign gains momentum. So these are basically using technology also and using certain more initiatives. I thought that this is an opportunity to share what we are doing so that you are also aware, since Ravi ji was saying that a lot of startups are there who are interested but they don't know how to access the government, and we were discussing that soon we'll have a summit on startups in health in Jharkhand, maybe in the month of September or October, as it is convenient. So now we come again to the presentation. This is the globally used technologies in health, how 3D modeling and AI-based platform, distance education, e-libraries as far as education is concerned, then pharmaceutical, virtual clinical trials, electronic prescriptions, as is going to be part of the ABDM, Ayushman Bharat Digital Mission, e-pharmacy, then research of big data. As far as hospital is concerned, electronic health records, medical image data, claims, Ayushman Bharat, Pradhan Mantri Arogya Yojana is utilizing these models for providing medical services to the population which comes under the net of Ayushman Bharat, and billing and finance data. Then research, which is very critical, next generation sequencing, genome sequencing, pharmacogenetics, research. Then it comes laboratories, patient data, how lab maintain the data, and then biomarkers data, logistics, billing data. Then outpatient OPD, that is telemedicine, rural health, wearables. People are using the watches for monitoring their health, patient data. Artificial intelligence is now going to be very, very critical in health management, healthcare, imaging, health monitoring, patient data, surgery, how we can contemplate, how we can forecast. A person may have a particular ailment in coming times through artificial intelligence, to mapping their parents, through mapping their relatives, one can have an idea and prepare, have precautionary and preventive initiatives to tackle that. Then blockchain, smart devices and telemedicine, as I already mentioned. Genome sequencing, then huge data which is going to be managed, that all through digital management, cloud computing, utilizing the cloud, automation and machine learning. So there are certain other technologies also, virtual reality, revolutioning the drug development, nanotechnology, you are utilizing the nano equipment to go inside the body and come up with a lot of information. Robotics, instead of human interface, you are having robotic interface, and then 3D printing of various organs, artificial limbs. So all these are new technologies which are going to come up and which we have to prepare ourselves. Unless we prepare ourselves, and the magnitude of our population which is rising, though Uttar Pradesh has come up with a population control policy, but they are keeping low. So we hope that, because that is the most critical. We talk about climate change also. So everything is dependent on the population. If population is limited, controlled, then things can be planned, but if the population is increasing, then everything goes haywire. We have to produce more in agriculture, utilize more chemical fertilizer, spoil the soil, more production by industry, spoil the water, pollute the air, so whole ecosystem gets disturbed. So this population is very, very important, and I am very happy that Uttar Pradesh has launched and is coming up with a population control policy. And these are challenges: the lack of infrastructure and the required technology, and then funding, lack of network in the rural areas, though Government of India is trying to increase the network and new schemes are being launched to enable the network reach the rural areas, but still it is a challenge. And then quality service providers, we have so many service providers who are more interested in monetary benefits, unnecessary tests. The patient has to go through unnecessary tests. So the quality service, proper diagnosis by the doctors, and this ABDM is going to be a game changer, since the data is all on one platform and one can cross verify, one can also go through the historical data, the legacy data, examine it and see whether the diagnosis which was made an year before or 2 years before, was it correct, was the medication given was in the right direction. So it is going to be a very transparent system which is going to come up under the ABDM. Then lack of digital education for most of the staff in the rural areas, particularly, as I was mentioning about Sahyas, but Sahyas, since most of them are using smartphones, so we have to train and we have to educate our people so that they can utilize, otherwise they will fall behind and they won't be able to catch up with the rest of the world and the requirements, as the requirements are rising. And then the security and privacy issues which are very critical. We have a district called Jamtara. Most of you must have seen the serial on, maybe on Prime, perhaps it was on Prime, Jamtara serial, in which the bogus call centers and they pilfer the money from the accounts of the people through the false calls. So this is a security and privacy issue that is very, very critical. We can go digital, but we have to have security measures. These are certain technological initiatives which are a few. We have n number of initiatives taken up. Health GIS, we are mapping the patients suffering from TB, patients suffering from leprosy, patients suffering from other diseases, and what is the command area utilizing the health GIS, then Garima Jharkhand for PC and PNDT, and then MIS for biomedical waste management, implementation of e-hospital, the hospital management information system, then Sahya Sangi portal, home-based newborn care it's a small section of the society, participatory learning and action, then human resources information system, and then DVD-MS, the drug and vaccine distribution management system. Then Swaraksha portal for managing the COVID-19 patients who are under isolation, and interactive IVR-based surveillance for COVID-19 patients, online MIS for malnutrition treatment centers, and then for Anemia Mukt Bharat, test, treat and track app, multimodal pulse oximeter for pneumonia detection, and fetal heart rate ambulatory devices as pilot project. So The lessons which we have learned is that technology has the potential to accelerate access and enhance equity in the coverage of health services. How we can close the loop by deploying end-to-end solution. Unless we have end-to-end solution, it cannot be left open-ended and it will not give us the desired results. Then client-centered intervention, because ultimately it is the client who is going to get the benefit. So it has to be client-centered intervention and technological intervention to improve the efficiency and effectiveness and cost effectiveness also. And power of partnership also needs to be leveraged. Everybody has to be involved from the village level up to the highest level. So these are certain lessons which are learned and lot of initiatives are taking up, and I'm quite sure that so many of startups and every startup is planning to intervene in certain areas, maybe in diagnostic area or in management information system or in providing services or in transportation. So the huge avenues and huge opportunities that are available for the startups to enter into, and the digital technology is the technology for future, and it is good for us that as early as possible we utilize this technology for better health services. Thank you very much. Jai Hind.